Good evening. The Government of India has instructed all citizens to avoid crowded places in view of the ongoing coronavirus pandemic. Large hospitals are one such type of places. For instance, JIPMER is visited by 8,000 to 10,000 patients every day, in addition to the equal number of attendants. Also, the crowd in the hospital is more likely to include patients with Covid-19 infection. Thus, there is a real risk of those visiting JIPMER catching COVID infection. Further, the visitors to hospitals are often elderly, infirm, and are more vulnerable, in whom the infection is more likely to be severe or fatal. Hence, the public at large is issued the following advice. First, patients with minor ailments seeking medical advice are strongly discouraged from visiting JIPMER hospital in view of the disproportionately higher risk of exposure to infections, including COVID-19 infection, in the crowded hospital setting. Second, the elderly persons and persons with such diseases are more vulnerable to serious and fatal infection with COVID-19 infection. Hence, patients with chronic conditions such as diabetes, hypertension, cancer, and heart diseases are on a regular continuous medication should avoid visiting the hospital simply for receiving the drugs. They can get their regular medications from a nearby government hospital or from Jan Aushadhi pharmacies at subsidized cost using a previous prescription from JIPMER. Third, all the patients needing elective, non-urgent surgical procedures or interventions are strongly advised to delay their visit to JIPMER till the Government of India lifts the restrictions. 4. Only patients with a critical ailment needing tertiary care facilities should visit JIPMER. Each patient needs to understand the risk of exposure to a large hospital such as JIPMER and balance this against the genuine benefit of such a visit. JIPMER regrets the inconvenience caused to its dear patients. However, it is purely the health interest of our patients that has forced us to make this decision. Thank you.